The World Health Organization says South Africa, where Omicron was first reported, saw a 9% fall in weekly infections and a decrease in hospitalization. The Africa CDC offers possible reasons.
First of all, is that many more people have been infected in South Africa. That is, they already had exposure to develop antibodies to previous infections like the Delta and the Beta when they all occurred. Then secondly, the rates of vaccinations in South Africa is really increasing. So if you look at the people that have been infected just naturally, and you combine that with people that have received vaccines, then this is what, I mean, I would not necessarily say herd immunity, but population level of antibodies have increased in South Africa over the last, during the course of the last 2 years.
With at least 27% of its population vaccinated against COVID-19, South Africa is among the top 5 countries in Africa that the Africa CDC says have high levels of vaccination. So far, Africa has received about 663 million doses of COVID-19 vaccines, of which about 340 million have been administered. Fully vaccinated people in the continent represent only 10.1% of the population, which is very low compared to the target of 60% of the population needed to achieve herd immunity against the pandemic. Some countries are already urging their citizens to get booster vaccines. The Africa CDC advises that it is vital to boost immunization of the basic vaccines first.
The first priority or business order is for us to get as many people as possible to get their first doses. A second order of business should be to get those who have received their first dose to go out and get their second dose. And then for the subset of population that are more vulnerable, the elderly, those with immunocompromised status, to get their booster. So our recommendation is not yet at the level of generalized boosting there. We can't even boost where you only have 10. You cannot even recommend general boosting when you have only 10% of the population fully vaccinated.
The World Health Organization says Africa's fourth wave, now experienced in 46 countries, is being majorly driven by the Omicron variant and warns that the fifth wave might be even tougher. Coletta Njohi, SABC News, Addis Ababa, Ethiopia.